let's be honest, Medicare can be challenging. And what we're going to do today, if we do it right, is break down Medicare so it could be less challenging for those who are trying to just figure out which option is the best one for them. So, Andrew, Medicare can be challenging, like I mentioned before, right? I mean, if you're 65, getting ready to transition from retirement, and you're looking at the landscape of what should I do for my health insurance options, Medicare usually stands out as the number one option to choose from.
Right.
But then there's so many different layers to Medicare that, we do it on a daily basis, helping our clients make sure that they're picking the right options for themselves. So we get it, right?
Mm-hmm.
But on the other side of the table, if you're scouring through the landscape trying to figure out, okay, what options are available, which one's the best one for me and my spouse, it can be a little, confusing.
It can be confusing.
Yeah.
It's one of those things. It's like it kind of pops up its head in so many different areas of one's life. I mean, the Medicare topic gets popped up during obviously your original search for health insurance.
Right.
It comes up in topic when you're looking for when you're entering the season of retirement. When you're filing your tax returns, it's like, what are you talking? Why are we talking about Medicare? I'm trying to figure out my tax plan. When you're talking about conversion, I mean, it's just one of those things, really, like you said, it's laced through so many different levels of one's retirement that it gets complicated. And I think it's a shock to most people because they get ready to either A, turn 65. Or B, they're riding up on 24 months on Social Security disability, or they're just trying to put together a tax plan, or maybe they're retiring late at the age of 68 or 70. And when they open kind of the topic, the book of Medicare, they're like, "Oh God, I need help. I need help."
Right.
And so so what we're going to do, like you talked about, is kind of just a quick snapshot today. Medicare A, B, C, D supplement. High-level overview, and then hopefully over the next several weeks, get into some case studies and a little bit more in-depth on just, hey, how do we not make a mistake when it comes to this decision, not just initially, but every single year, because you got to do the assessment continuously.
Right. And you're right. And one of the episodes we're going to do in the future, we're going to talk about some of the traps to avoid and a little sneak peek. That's something that most people aren't aware of, that at least for your drug plan, at least, that you should be looking at it every single year during open enrollment just to make sure that the prescriptions that you're on are covered by the plan that you were on just that in their current year. So that the future year, you're not stuck in a loop because your prescriptions aren't covered or they're not covered as much as they were before. Mm-hmm. So let's talk about Medicare from the beginning. Okay, so there's really four parts of Medicare, right? Medicare A, B, C, and D. So let's just start with A, Medicare Part A. I would like to call it hospital insurance, right?
Well, you wouldn't like to call it. The government calls it hospital insurance. We talk about it. Mo's tag name.
I created
insurance.
it, but hospital insurance, right? So I like to think of it as it covers the facilities, wherever you're getting your treatment done, right? So whether it is inpatient hospital care, skilled nursing care, the hospital, hospice, any place where you're actually getting the treatment done, that's what Medicare Part A covers. Is that pretty simple?
I think you're absolutely right. So the best way to look at Medicare Part A benefits is benefits that really cover the cost of the physical structure of a hospital. Like you're talking about brick and mortar, your room, your board, your food. Is it going to cover the doctor that kind of opens the door, pops his head in, says, "How you doing?" checks your vitals, and then sends you a bill for $1,000? No, it's not. But it is going to cover the actual cost of the facility and staying there. So now, with that said, does it cover everything? Absolutely not. I think the best thing to do is start with the premium to kind of break down the cost associated with Medicare Part A. So as well as I do, Mo, that when you are turning 65, apart from disability, okay, just everybody else that is not on Social Security disability, turning age 65, you're going to get Medicare Part A.
Why is that?
Because Medicare Part A, first and foremost, it doesn't cost a premium, okay? And although it's not great benefit. It kind of rides in the background. I think that's a lot of people's questions is, hey, I'm turning 65, but I'm not going to retire, or maybe my spouse is not going to retire. I'm still on my spouse's benefits, or I'm on my employee benefits. And for that reason, you don't need Medicare Part B. We'll talk about that a little bit later. But you get Medicare Part A. And it's not like a huge benefit, as I mentioned. It kind of rides in the background. It's not your primary insurance. And for that reason, there's no premium for most individuals that qualify for Medicare Part A.
Okay.
So, that's one benefit, is that there's no monthly, cost to it. But there are costs associated with Medicare Part A if Medicare Part A is all you had without any other insurance, including employee benefits.
Okay.
Right. So, to kind of break down, I'm going to put this actually on the screen here and just kind of work through some of these expenses. But when it comes to hospital insurance, Medicare Part A, you can see that there's a deductible for year 2024 equal to $1,632. It's not a super big expense, but it's there.
Yeah.
Right. You have daily hospital coinsurance after the initial 61 days in a hospital, equal to $400 per day, just over that. Let me stop right there and say something with Medicare Part A. One of the reasons why people don't just have Medicare Part A without supplemental insurance, a Medicare Advantage, or employee benefits, Mo, is because Medicare Part A hospital expense, it really kind of runs on this 60-day running
like target, or
I'm a lack of words here to explain it, but basically what it is, I'll give you an example, maybe that would help. If I go into the hospital, chest pain, panicking, Amy calls, I get transported, I go into the hospital. Initially, when I walk in that door, as soon as I'm admitted, it starts to count.
Yep.
Okay. Now, if I go back in the hospital within 60 days from that initial day, so let's say I'm there from February the 1st to February the 4th. Okay. And then I'm released. I go back within 60 days of that initial visit, even if it's for something totally different, car accident, transported, talking about a rough few months, right? Back in the hospital, I pick back up where I left off. Okay. If I'm outside of that 60-day window, I restart the deductible and the coinsurance expense. Okay. Once again, kind of pointing to the reason why there's so many different other companies trying to offer you insurance.
Right. Yeah. Because it doesn't work like your normal, quote unquote, normal health insurance that most of us are used to with our employers. Right. There's not this running clock on a time schedule. It's usually per year.
Right. That's what we're used to.
That's what we're used to.
Right.
Yeah. Okay. So that's Medicare Part A. We talked about associated costs, but for the most part, for most of us, it doesn't cost us anything.
Right.
And there's a penalty, I'm assuming, right? If you're 65 years old and you don't sign up for Medicare Part A.
Well, you're right. There's an ongoing penalty, and then that's kind of accruing in the background, so that when you do get it, you're going to have to pay the cost at that point in time. Now, let me say this. I don't think I've ever ran across anybody who's ever had to pay a penalty for Medicare Part A.
Yeah.
It's just, it's unlikely because there's no cost to it. So why would you go without it? So I would say that, I don't really know of a situation otherwise, but obviously you need to speak to an expert. And if you're getting on to Medicare, you're age 65 or older, regardless if you're working and still covered by your provider, regardless if your spouse is working and you're still going to be covered by their benefits, Medicare Part A should, without question, be turned on at 65 during your enrollment period, your initial enrollment period.
Which is 3 months before your 65th birthday, the month you turn 65, and 3 months afterwards.
That's exactly right.
So that's 7-month window.
Yes. And we'll hit that a little bit in greater detail as we move to Medicare Part B.
Okay. So nice segue. So Medicare Part B. Okay. So A takes care of the brick and mortar. B The medical
Everything else.
insurance is that doctor that peeks in, right?
Right.
The doctor that peeks in, the nurse that pricks you, the lab work, the blood work, the X-rays, the MRIs, basically the treatment itself. The medical insurance, Medicare Part B, covers that. Now, you're 65 years old, you get a Medicare Part A, B, options on whether to enroll in it or not.
Yeah, so let's go back to that enrollment for a second. Okay, so I'm turning 65, all right? My scenario is I love what I do for a living. You know, we help people with their tax strategies. We're helping people with their retirement plans. We run a private office here at Asset Management Group. I love what I do. There's no way I'm giving this thing up, right? Well, because I'm going to continue, I get insurance, right? And because of those benefits, I'm turning 65, but I'm like, I don't need health insurance with Medicare. So what's going to be the advice from me? Number one, I need to be on Medicare Part A. We've already established that. Medicare Part B, though, because it costs a premium, you need to pay for things that are going to give you a benefit.
Right.
Okay? You already have primary insurance. And as long as you work for an employer that's offering qualified insurance, then you don't have to have Medicare Part B so long as you're actively working.
So long as you're actively working. Keywords, a lot of keywords in there, and we'll tease it for next week. Actively working, and just remember to stay tuned for this Medicare series, because you'd be surprised at how many kind of challenges that people have as far as when to enroll and some of the penalties that could inflict them if they don't do it the right way.
Yeah.
But okay, so Medicare Part B, there is a premium. Okay, so for most people, well, I won't say for most people, the standard premium is $174, give or take a couple of cents per month.
That's exactly right.
That's per individual. So that covers Medicare Part B. But there is this little asterisk with that premium, because the premium is actually based off of your income. And your premium can actually increase based off how much income you have. So let's break that down a little bit.
Well, and I was going to, but I realized that our chart here is a bit off. So I tell you what, we'll get in. You know what? I think what we'll do, Mo, is, because I don't think this is right. That's interesting. I think those are older values, not year 2024. But let me say this, because this is something we're going to dig deep into when we talk about mistakes from a taxable standpoint. Okay. To your point, though, and I'll come back to just Medicare Part B, the cost of Medicare Part B can, without question, be increased based off of your modified adjusted gross income. We'll jump into what all that means in an upcoming show. That said, if you are retiring, you're turning on Medicare Part B, you're retiring from your active employed position. It doesn't matter if you're 65 or 75. If you are actively working with an organization that is greater than 20 employees offering qualified insurance, don't worry about the penalty and the noise about Medicare Part B. You can defer it. With that said, you finally turn that benefit on. Your premium, $174, can be increased beyond an additional $500+ per person per month, period.
Per person per month.
Based off your modified adjusted gross income.
Wow.
Okay. And so the point is once again, it's crazy how this whole story of your financial well-being is so interconnected. Because you want to save correctly so you don't have these challenges. You want to perform tax strategies, but by doing so you could, create an additional expense that otherwise you didn't intend to create, right? So Medicare Part B premium is one of those, though, that absolutely can eat away your retirement savings if you don't manage your MAGI correctly, and that premium can be adjusted. Now, let's assume, though, for today's sake, it's the base premium. Okay. So the average individual entering into retirement, they're 65, they're going to retire, they're going to turn on Medicare Part A, Medicare Part B.
Okay.
That's going to be the package offered to them by the federal government. Okay. And they're going to be ready to rock with A and B. Now B does have co-insurance with it.
Okay.
Right? It's got a gap.
Yeah.
You know what I mean? and we don't have to get into the great details, but let's talk just a little bit about that, because I think that alone explains why there's so many other organizations out there, public entities, offering insurance to try to go with your Medicare.
Because that's really the confusing part, right? I mean, like because again, A and B, like you said, your average 65-year-old who's getting ready to retire, I sign up for A, I sign up for B. Okay. Now you mentioned there's coinsurance. Well, what B does is it leaves a gap, like you mentioned it, a 20% gap in coverage, and so that's where now how do we fill that gap? Which is why Medicare Part C is called Medigap, right? Because it's filling in that gap that that's left with Medicare Part B, that 20% coinsurance.
And I don't want you to go past that too lightly. All right, 20%. We're used to with insurance while we're working, right? We look at our plan here at Asset Management Group and the staff that works for our organization. We're used to, okay, you may pay co-insurance, but it's up to a limit.
Right.
Okay. We're talking about a max out of pocket. Okay. So you think 20%, not too big of a deal, as long as that max out of pocket. Okay. You get into Medicare, there's no max out of pocket. All right. You're covering 20% of all the cost indefinitely. Okay.
Yes.
That, in essence, is why these other plans exist. Medicare was never intended to cover you and your cost of care as a ordinary insurance plan, one that you've been used to for all these years. It is a foundational coverage, just like Social Security is to retirement, Medicare is to your health plan. It supplements, it's a small piece
of
to the bigger puzzle.
Plan.
Yeah. So you have to get additional insurance. And so now you're segueing in here to Medicare Part C, right? Which is interesting because people think Medicare Part C is offered by the government because it's Medicare, Part C.
But it's not. It's
Correct.
offered by private health insurance companies, which is why, as you're turning 64, 65, your mailbox and your mailbox and your inbox are flooded with all different carriers, right? Whether it's Humana, Aetna, United Healthcare, all these different carriers are just flooding your inbox because now they're able to offer you a Medicare Advantage plan or a Medigap plan.
Let's be honest. There's people fighting for your information at 63, 64.
Oh, that data is important.
So our firm here, Asset Management Group, we own a agency that's licensed throughout most states in the Southeast, a company called Senior Care Solutions. And so we have played in that field, in that game, since 2007. And you and I both know, there's a bunch of people ready to feast out there when you hit 63, 64. And they're logging, man. They're getting your information. They're getting ready. And they're just trying to compete for your business. Okay. So quick little nugget tip.
Okay.
As you're approaching age 65, first and foremost, take a breather, okay? You don't have to tackle this thing until you're within 3 months, all right? Calm down. No reason to go do a ton of meetings. Second to that, Google online Medicare's logo. You want to look for Centers for Medicare and Medicaid Services, CMS. Look for the logo. Go on there and Google Social Security Administration logo, that stamp, right? If you get information and you're confused, this looks like it's from the government, unsure, it's going to have those
logos.
Correct. It's going to be formal. It's going to have those types of items stamped on the envelope or printed. And that way you're definitely more clear and aware of okay, what do I need to keep? What do I not? Everything else you can get rid of until you're within 3 months.
Yeah.
Okay. As you're entering into that third month, contact a independent agent or agency. You're more than welcome to contact our firm. And at that point, then you can go through the formal process of your situation, what you need to do. Yeah.
So those three logos are Social Security logo, CMS logo, and AMG logo. If you see those things in your mailbox, you just keep, no, but that's serious. But that's a good point, right? Because part of the confusion is when you're this. I don't think we even. I don't think we're what's the best word I'm looking for? We are not sugarcoating it. When you turn 63, 64, you are flooded.
Oh, you're inundated.
You're inundated. That's what I was looking for. You are inundated with information. So you're right. If it doesn't have Social Security or CMS on it, you could just toss it out for at least 3 months before your birthday. So during that initial enrollment period. So Medicare Advantage covers that 20%. That again, Medicare or Medigap plan covers that 20% that Medicare Part B exposes you to.
Right, but let's stay here because so with Medicare Part C, Medicare Advantage, there's still costs associated with that.
Okay.
So if you just take a quick look at the screen we have here, basically there's two options when you get Medicare. If you're going on Medicare, you're turning on Medicare Part A and B. Really, there's only two different directions you can go, unless you're getting insurance through a state retirement or a federal retirement. For the most part, these are the options you're going to face. One of them you started out with was Medicare Part C, also known as Medicare Advantage. Few quick things about that. Number one, it's insurance offered through a private insurance company. Okay. So when I say that, these are companies that you've heard of. These are your Blue Cross Blue Shields of the world. These are your United Healthcare, Humana, Aetna. These are those types of companies that you're typically have used in the past, right? It's very similar to insurance you've had in the past, right? So these are what we would call network plans. Okay. And by network, what I mean is things like HMOs, PPO, POS, and so forth. These are referencing a network or essentially a group of physicians that are approving and agreeing to the plan documents, the plan coverage. Okay. So, well, that sounds very familiar than what you've always had.
Yeah.
Typically when you enroll at 35, 45, 55, 65 years old, you're enrolling in a HMO, a PPO, a group health plan that offers that. From there, you have out-of-pocket expense, right? Typically copays, co-insurance, right? And then what else? Deductibles, right? The reality is Medicare Advantage, the best way to make it simple. This is insurance, very similar to the benefits you've always had. Okay. Now, the one thing that is different, okay, is the fact that when you enroll into a Medicare Advantage plan, here's the decision you're actually making. Medicare Advantage does not supplement Medicare. Okay. What is Medicare offering you? The government, we've already talked about it. It's A and B, right? Now, when you go enroll in a Medicare Advantage plan, you are literally knocking on the door of Aetna and you're saying, look, can you replace the position of original Medicare? Okay. Well, what's their position? To cover you for A and B. So you're basically getting those benefits through a private insurance company. Okay, there's reasons why you would do that. We'll talk about that a little bit later in a different show. But that's what you're doing. So guess what? You start the year, your Medicare blue and red card, put it in the filing cabinet. You don't need it. You're not going to use it. And if you use it, it'll be declined. Okay?
Interesting.
You are using a private insurance company to pay for those benefits. And then lastly, what I'll say too is that this coverage, to make it even more similar to insurance you've always had, includes your Part D, which is your drug plan.
That's a lot. So how much does that cost?
Well, so what's interesting, you guys know this because you're sitting there, right, trying to watch some, Saturday college football, and you're trying to watch some NFL football on Sunday, and these darn commercials keep popping up, zero premium. And you're like, man, this stuff is free. All right, come on now.
Yeah.
You've been on this planet for 60 plus years. You know it ain't free.
There's no free lunch.
There ain't no free lunch. So what's happening is it's actually simple. Let's say I'm Medicare. You come to me, you say, hey, I'm not going to use you, the government. I'm going to use this company. Okay. Now, what am I collecting from Mo? I'm collecting that Medicare Part B premium, right? You remember that?
Yeah, the 174.
So that 174, maybe more.
Maybe more.
Yeah, if your MAGI is higher. I'm collecting that premium. Now that you have chose not to use the insurance that we're offering, well, I've got this money that basically is covering no benefit. So based off of the area in which you live, I, the government, process a little bit of a transaction fee and then send on the back end what's left to the insurance provider.
Okay.
So when you see, zero premium, basically what they're saying is we're not going to charge you anything in addition to what we're already getting
Right.
from Medicare by you selecting us.
Okay.
Okay.
So it's zero additional premium, if you want to call it, than the 174. It's a very nice little marketing tactic that they put when you say zero premium.
Yes. Look, let's just be honest. If I'm the government, that's a pretty sweet gig right there.
Yeah, I don't have to do anything.
Transaction fee, 20% just to send it over here. What are we talking about?
That's not bad.
Yeah, it's not bad.
Okay, so that's Medicare Part C. That's the Medigap plan. Okay, so there is another option, right? So you're saying this decision for Medicare Advantage in the grand scheme of things is that I'm saying I don't want Medicare Part A or B. I want to go with this private health insurance company to basically handle my medical services. But if I don't want that option, I still want Medicare Part A and Part B, I still want to solve that 20% gap, then there's these supplemental plans that I can choose. And these are the ones that there is a premium. They're still offered by private health insurance companies, but there is a premium, right? And I would say that the average premium, give or take, is about $125, $130, $140, somewhere around there. That's in addition to the Medicare Part B premiums, right?
Yeah, that's exactly right. And when you're looking at these companies, the name kind of describes it, right? Medicare supplement, right? Meaning, or another term that people hear is Medigap, right? It fills the gaps, it supplements something, and that's Medicare, right? So Medicare, we've already talked about Medicare Part A. You got all the deductibles, the running 60-day, time clock, if you will. You've got the 20% co-insurance for Lord knows however and how long and how high. So you're going to get something in addition to that. If you go the supplemental route, you're adding insurance, something that will connect and work well with Medicare, original Medicare A and B. Now, when you go to the doctor, you're literally handing them two cards. Right? You're handing them the blue and red card and then the supplement, and you're like, hey, just don't bill me. Right? Let Medicare pay for it. Well, they don't pay for it, bill this guy. Right? Because I'm paying for this. And at the end of the day, I want to be clean. Now, there's a lot of reasons why you and I both at our firm and our group here at Asset Management Group, along with Senior Care Solutions, will influence our clients to maybe, consider this as a primary option. We'll talk about that when we hit the episode on some of the mistakes you don't want to make. But it is good insurance. And so some of the things that make it good, well, how about the premiums? Not too bad.
Not too bad. If you can afford it, $125, $140, give or take, that's not bad.
Okay, now, and we talked about Medicare Advantage being zero. So clearly, if you're going to spend, $125 to, maybe $140 or something like that, it better be for a reason. Okay. Now, Medicare Advantage, we talked about had networks, but Medicare supplements,
no network.
No networks.
That's attractive, especially if you have any type of specialist that you may have to see.
I'm going to tell you right now, one of the biggest benefits about not having a network, first off, if you live in a big city, the truth is in the suburbs of Atlanta, Birmingham, some of the cities that we work in, Florida, and some of the bigger cities there, the reality is there's so many doctors. Medicare Advantage, you're going to have a network that works well with the majority of doctors, right? It just is what it is. But where these plans really make a big difference is when you have someone who's really facing a unique and very challenging illness, right? They need to go to a specialized facility, right? At that point, you're going to appreciate having a supplemental plan. From our experience, from the outside looking in with watching some clients go through those types of scenarios, that's one reason why. Is it necessary for today? Well, maybe not. If you're healthy and you're rolling, you don't go to the doctor that much. But at the end of the day, if something was to go wrong and you do need treatment and it is specialized treatment, that supplemental plan is going to be your friend.
Yeah, I mean, so you're right. I mean, you think about it, right? At 65 years old, God willing, you're healthy. So some of the decisions that you're choosing is not necessarily for today. It's for beyond tomorrow, right? It's for, hey, if I'm 75, if I'm 80, my health starts to decline, I want to make sure that I have the right plan in place for that untimely decision. Deductible.
Yeah.
Right. There's a deductible of what, $260?
Well, and let's just stop here. There can be a deductible, and there likely is a deductible. Okay, depending on the supplemental plan that you choose. Okay. Now, one thing that I will say makes it very easy for an individual that's shopping for insurance with supplemental plans. These are standardized plans. Okay, and what that means is like the government has created the plans, not the companies. Okay, all a company can do is sell it.
I love that.
Right. I do too. So when you're looking at that chart, Medicare, for whatever reason, they have chosen to use a lot of letters for describing different plans, right? So you have A, B, C, D, and the E, G, and F, and M, and N, and all this stuff, right? We'll give you, I tell you what, we won't do it today. But in a future episode on this series for Medicare, I will enlighten on what Mo and I would recommend as a starting point. Speak with someone, get some professional guidance, speak with us. But we'll let you know. I'll let you know what I put my mom on. How about that?
That's
fair enough.
If it's good enough for your mama, it's good enough for everyone.
That's right. That's right.
But the reason why I slightly said that I love the being standardized is because kind of helps with the confusion, right? So a plan, plan N from a United Healthcare, Humana, Aetna, whatever it may be, they're the same plans, right? It's just different providers providing them for you. So
that's exactly right.
So what I said I like that is because, again, it's not as if some other company can offer you a little more, make it a little more attractive with premium wise, but the coverage itself is the same plan.
That's
so
exactly
covering
right.
the same thing.
Which is where you start.
Right.
What is the plan that I need? What's the plan that best suits me? And then from there, I go out and find the company that works well with that. And then, of course, the first question people ask is, well, what if my doctor doesn't accept United Healthcare? But remember, when it comes to supplemental plans, if your doctor accepts Medicare, then they have to, by law, accept your supplemental provider. Okay, period. So there's no networks. So you don't have to worry about that. Find the plan you want, find the provider. Now, I will say, there are doctors and physicians that might prefer to work with certain companies over the other. And for that reason, I think it makes sense to find a company. We'll give the tricks and the trades of how to find the right plan and how to find the right company. But there are things you need to think about when you're choosing. Don't just go with the lowest premium.
Yeah.
So what else here? So no networks, could have a small deductible. And the reality is most of these plans are going to cover everything else.
Yeah.
They're going to fill the gap.
So for as a planning, or as you're planning, looking forward, you've got your Medicare Part B premium, you have your monthly supplemental premium, you may have a deductible, but that's part of the plan. You'll know what the deductible is. You could pretty much know what your out-of-pocket costs are going to be for health insurance for that year.
Yeah, right. And it's beautiful because, especially when you're able to incorporate that in your plan. When you ask, Mo, look, man, when you're sitting with some of our clients and you ask them, look, what's your biggest concern? What do you feel like is your biggest financial risk in retirement? What do they say? Healthcare. Yeah. They feel like that's the biggest exposure. All right. So when it comes to your traditional health insurance and the cost that would be associated with a traditional healthcare event, hospital, doctor, diagnostic testing, stuff like that, you don't have to be concerned about that. You really don't. These supplemental plans allow you to really budget exactly what you're going to pay in a good and a worst case scenario, right? And the margin between good and bad is just the deductible.
It's just deductible.
Yeah, I mean, it's so small, right? So don't cut yourself short. If you're going to spend money anywhere in your retirement, this might be a little area to fork up a little extra cash and get a good health plan, and just make sure you're riding well into retirement with what you can expect. Now, supplemental plans don't cover everything. Remember, They only fill the gaps of Medicare.
Yeah. So you mentioned forking up a little more cash. Let's fork up a little more cash for your prescriptions, which is Medicare Part D. D for drugs, right? So now we've got A, brick and mortar, B, diagnostics, labs, x-rays, all that good stuff, which leaves a 20% copay. Well, yeah, leaves a 20% copay. You can solve that 20% with an Advantage or supplemental plan. But now, drugs, prescriptions, Medicare Part D.
Yeah. Now, Medicare Advantage, we talked about. And by the way, if you're listening to the podcast, we do have a visual kind of representation of what we're talking about. So go to the YouTube channel, check it out. You'll be able to see us kind of write this out a little bit. And I do apologize if I've misspelled any word.
And don't worry, if you want a copy of this, we'll clean it up for you.
Yeah, it won't be
send
Andrew
you one.
scribbling on a tablet, right? But nonetheless, if you go the Medicare Advantage route, those plans oftentimes include, not all, but most include a drug plan.
Okay.
The supplemental route, they don't. You have to add it, right? So going the route that we've been talking about, you have Medicare Part A and B. You go and add a Medicare supplement. That's your second insurance provider. That's the second card. Then you tack on a drug plan, right? So now you got three providers, 3 cards, and you're going to use them, accordingly. The drug plan is nothing more than a drug plan, right? You're going to go to the pharmacy, you're going to use it. We will definitely talk about tricks of the trade and how to reduce drug costs coming up. You got to stay with us. But nonetheless, a drug plan, you're going to spend anywhere from as low as there's going to be a premium, okay?
I've seen as low as 50 cents.
Isn't that crazy?
Yeah.
I don't know how that works, because there's no reimbursement on that. But,
Right.
50 cents. So 50 cents on up to, probably an average cost is like 35. But now there's plans that go up close to $100 a month, right? But I would say most of our clients are going to be anywhere from that 50 cent plan on up to like 35
bucks. Yeah.
Yeah. And then from there, that's a monthly fee. From that point, you're going to then just pay coinsurance. Okay. So you go to your pharmacy and you're on, metformin or atorvastatin or, whatever prescription you're on, levothyroxine. And when you get those prescriptions filled, you pay the copay according to your plan. Or maybe there is no copay.
Maybe there is no copay.
Yeah, if it's a preferred generic, that's one thing that these companies do to try to compete with other companies is, as long as you're on a preferred generic on their list, you're good to go.
Yeah. Yeah, and that's the part of the plan that I think that you should really pay attention to on an annual basis, because these drug plans can, on an annual basis, decide how much they're going to cover for those prescriptions, whether they'll cover those drugs or not. Right. And so you don't want to be in a situation where you're not analyzing and reassessing it annually during open enrollment, which is October 15th through December 7th every year. And just making sure that, okay, for this upcoming calendar year, is the drug plan that I'm on right now, will it be the best plan for me at this moment because of either the drugs that I'm on or the drugs that I was just newly prescribed, and just make sure that it's covered for the following year.
And we are going to break down in a full episode how to win in the 2024 OEP, open enrollment period.
Yeah.
So you got to be able to connect with that video, watch it. We're trying to do this whole series prior to the date that you mentioned, which is October the 15th. It opens it up.
Okay.
Right. And this is for everybody who is already on Medicare, 65 and older. What do you need to do? How do you need to think? How do you need to prepare? What can you do today to ensure that you're ready to make the right decision?
I love it. I
do too.
Yeah, so we broke it down. I mean, hopefully we did a good job. Hopefully everyone was able to follow along with Andrew's writing and with today's conversation. But yeah, Medicare Part A, B, C, D, we broke it down. And I would say to get started for our next couple episodes, 2 things. 1, Medicare.gov.
Yeah.
Create a login, create a profile for yourself.
Yes.
So that way you can follow along on future episodes. And familiarize yourself with SSA.gov, because it's weird, right? But if you're going to enroll in Medicare, you would think you go to Medicare.gov to enroll, but you actually enroll at SSA.gov, right? So just familiarize yourself and create a login, create an account for yourself at SSA.gov. and Medicare.gov. They're both free, but it's as you're entering this season of retirement, those two sites, you definitely want to get familiarized and plug yourself into those sites.
And also what I'll add is that, remember, everybody's story is different, So your scenario might be way different than what we've referenced. Be sure to connect before you make any, major decision on enrollment and different product types and company plans that you might be considering. Make sure you get the guidance that you need, to ensure that you're making the right decision at the right time. So is that a wrap?
That's a wrap.
All right, my man. Listen, great start, I think, to this series on Medicare and just what it takes to make the right decision to ensure that 2025 and your start in Medicare is the right start for you based off of your situation. So that's it. Stay with us. And we'll see you next week.